being in a country that has a double burden of disease and being the Red Cross, which our role is to save lives and promote health. With the coming in of the Novartis Access initiative, I think for us it was such a breath of fresh air, because you had communities where they were asking you, so after I know I have cancer and I can't afford the drug, then what? So then people were already starting to resist even the awareness creation bit. But with the coming in of this initiative, it brought the sense of you can actually afford the treatment.
In many ways, this problem is a result of past successes. What we're seeing now is these dramatic increases in life expectancy. The health systems which were established to deal with acute, generally infectious diseases have not caught up with the new situation for non-communicable diseases.
Even though we work with a very specific section of the population which is affected by violence and conflict, one of the things we are seeing more and more is the effect of not treating diabetes, for example. Yes. We have a massive amount of physical rehabilitation programs, and we used to feed amputees because of war wounds, weapon wounds. And today, our largest percent of our amputee patients are due to diabetes. I mean, this is a staggering number, and it's a shift that has taken place in the last 10 years.
If we can treat AIDS, why can't we treat diabetes? Why can't we treat cardiovascular? They're easier to treat. Blood sugar, blood pressure, those are simple tests, and yet we don't do them anything like as well in these environments, and it's a matter of priority.
We don't have the answers, so we are like you, learning by doing, and we are part of this number of organizations looking at these challenges.
And having the Novartis Access, I think, is a signal that there is a new priority. This is the new frontier.
One role that meds is playing is education, and that is building the capacities of health workers. How do you detect some of these conditions early enough? How do you also educate the communities so that they can take care of themselves? Because early diagnosis would mean successful treatment of these NCDs.
There is no way we are going to address NCDs in low and middle income countries, or really around the world, without working through public-private partnerships with mutual accountability among all partners and a very different way of working. It is a fundamental necessity, it is our only hope, and it has great potential.
For us it is important with an event like this to really bring stakeholders and the broader access community together to share experience in a transparent way and to obtain many valuable insights and feedback that we can use in order to refine and shape the program as we go. We want to continue open dialogues and are planning to convene the stakeholders again towards the end of the year.